Ready? Hi guys, how are you? I'm Dr. Fiona Gupta. I'm a movement disorder neurologist here at Mount Sinai.
I'm Brian Kopell. I'm a neurosurgeon here at Mount Sinai.
And we are so honored and pleased to have two of our dear patients who have had deep brain stimulation within the past few months, Wendy and Michael. Thank you so much for coming. So typically once a month, one thing that we like to do at Mount Sinai is do something called DBS candidacy, which is a really great opportunity for any patients who are considering deep brain stimulation or any family members who want to know more about it to come in to meet with Brian and myself, and we typically do feature one or two patients to share their stories. So this is a really exciting Facebook Live for us in that we are doing it live, and we have two of our patients here to kind of give their experiences. And again, there's no question that's too big or too small. So please, flood us with any questions that you may have throughout the process.
Great. So, the personal decision of a patient to undergo what is essentially elective brain surgery to improve the quality of their life has got to be a difficult decision at best. And so I think what would be helpful for everybody watching this right now is for each one of you to kind of just talk very briefly about sort of why you made the decision to go forward with surgery and its impact on the quality of your life. So how about you, Wendy? Why don't you start with that?
Sure, of course, thank you. The main reason I decided to go ahead with DBS was because my dyskinesia was so incredibly bad, especially in the evening, that it felt intolerable to me, where I felt like if life was going to be this way forever, I wasn't that interested in continuing a life like that. And so I started researching options for feeling better, ways that I could improve the quality of my life and be around a long time for my kids and my husband. So that's why.
And Michael, how about yourself?
I was diagnosed with Parkinson's about 8 years ago, and I was pretty much able to control the symptoms of medications for about the first 6 years, and this last year became intolerable. Started looking at the alternatives, and DBS is the main game in town, if you would.
Did you look at any other alternative strategies besides DBS, either one of you?
I tried different medications. I think this was the fourth that I had taken as far as Parkinson's type of medication. Sick or had other ill factors, and so I didn't try anything more invasive than that.
How about you?
Other than medications, didn't try anything else, but this is one of the main procedures that's reversible, if you would, down the road. If anything came out, if there's any kind of fix down the road,
Did you any of you research? There's another way that the medication can be delivered into the body via a pump that goes through a tube into the stomach. Did you? Any of you? It's called Duopa, but did any of you do any research with regards to that?
I actually never heard of that. I
Yeah?
did not come across that in my research. No.
Okay. How about you?
never heard of it,
Okay.
and I didn't react well to the meds.
Yeah.
Well, another, one of the things that people sometimes look into is a device where it has to go through a tube that goes into the abdomen, and then you have these cartridges, and you have this little purse thing that you wear on the outside with the pump, and it gives like a continuous level of drug.
That's
Like a 16-hour infusion of levodopa.
Right.
But in cases like Michael's, there are some patients who are just intolerant to the medication, who really kind of have these highs and lows. And so what's nice about the deep brain stimulation route, I think for you, was really an alternative to medication. And in most cases, we are able to reduce medication somewhat after DBS. I don't know if you want to tell what your meds are right now.
I'm med-free right now.
It's incredible. Yeah. I still take medication, but a lot less. I was taking 3 tablets of Cinemet every 3 tablets every 3 hours or so. It would wear off after about every 2 hours and 45 minutes. And I was taking that not around the clock, but until I went to bed. And I take probably twice a day now.
So I'm curious, again, this is about your personal experience, and I think patients out there contemplating this would, really, the more information they can get from guys like you to sort of help them in this process. So what was harder than you thought this process was going to be like, right? And one thing that was much easier than you thought it was going to be. That would be kind of interesting for them to say.
Sure. For me, what was harder was the emotional, my emotional response. I consider myself to be a very strong person. I'm a social worker, I'm a therapist. I have a lot of tools in my toolkit as far as dealing with emotions. And I was shocked at the impact, the depression that I felt after the surgery. It was very pervasive and it was severe. I needed to go to a therapist. I needed to take some time off work, which I did not anticipate. So, and I'm much better now. It's only been a couple months and I feel much better, but that was surprising to me. I was not expecting that at all.
What do you attribute that to? Do you think just the process or the emotional release of going through such a...
I'm not sure. I haven't kind of decided what that's about yet, actually. I think it was just more invasive than I thought it would be. I mean, you'd think that would be intuitive, that it's brain surgery. Some of these things going on your brain, and that's invasive in and of itself. But I think the experience of being awake in the surgery was kind of traumatizing for me. And I don't mean that in a clinical sense. I'm not trying to dramatize, but being awake and hearing interactions between staff. And it was actually really difficult for me, that experience. And
Okay.
I wasn't expecting all that.
I see.
Yeah.
And what about something that was easier for you?
Easier for me. That's a great question. What was easier than I expected? I guess the recovery physically was easier than I expected. So it was more difficult emotionally, but physically I felt that I didn't feel that bad physically within days after the surgery. The recovery was a lot quicker than I anticipated in that way.
Right. Okay.
Yeah. Like it didn't hurt as much actually as I thought it might.
Yeah,
like the sutures didn't hurt, the sites didn't hurt,
I see.
and I didn't expect that. I expected it to be more painful than it was.
I see. Okay. And Michael, do you want to take a crack at those two questions?
I think the worst symptom I had from the whole process, the 2 surgeries plus the battery,
Right.
was the actual MRI leading up to the process. The MRI, they took me to such a deep level of anesthesia that I had trouble urinating after post-surgery. And it turned out that there's an alternative to the anesthesia that they use that I could have asked for, which I didn't know I was going to react that way. That would have alleviated the problem, because in the other 2 surgeries post this problem, I didn't have that problem. I had no mental ups or downs after the surgery. I was pretty steady. I didn't get the same impact. I was sore. My head was sore. I think for 3 months I felt soreness, but I never really felt the pain.
Okay. Was there any aspect of it that was easier than you anticipated?
Going home after the first programming,
Right.
I'm saying to my wife, I don't know if I feel any difference. I don't know if I feel anything. And by the time I got home, I was feeling great.
Right. Okay.
That's great. And I think it's really important you bring up that word process, because really I think once we have kind of made a joint decision together to kind of push forth with, determining if you're a candidate, it is a process, right? There's the testing that needs to be done, and then the psychological testing, then you meet Dr. Kopell and his team, and you have the intraoperative process, and then obviously the postoperative programming process. One thing that's, I think, in doing this for so many years is that, again, there's no 2 people that are alike, and everyone is very different with how they handle things emotionally and physically, and it really does take a team. And so, I think, just to understand that you do have that team around you, whether it's post-surgical, Brian's very much still part of it, and as is our psychologist and things like that.
It definitely feels that way. Like I feel the response from staff here has been incredible. Like anytime I reach out, I either have an immediate response or shortly thereafter. It definitely feels like I'm part of something here.
How about you feel? Do you feel the same way, Michael? Or
My wife's a nurse in the medical field, and she comes here and she's so impressed with the whole team here. From the receptionist all the way to any calls I've ever made, any issue I've ever had, just resolved very, very, very easily through you. And I came from, I looked at DBS at a different site before I chose to have it done here. And I don't think they worked as a team anywhere near like it's done here.
I think a team approach is critical to getting success stories such as both of you. What about this notion of fear? You brought this up, Wendy. what would be, your experience, because you're now on the other side of it, in terms of patients out there that are considering the surgery and they are wrestling with fear? How do they get over this? How do they deal with this? What would be your suggestions for this?
To talk about it.
Uh-huh.
That could be to family,
Uh-huh.
to whoever you feel close to that you can confide in. It could be a professional, either to see a therapist, somebody that you can process that information with and your feelings. I think it's important to be honest with yourself, but also to have resources around you to help you get through that.
Mm-hmm. Mm-hmm.
Because that's normal. Fear is normal.
Right.
Absolutely.
I mean, fear keeps us from making mistakes and doing
Sure.
terrible things. So I think fear is healthy.
Right.
Not to be so hard on yourself, set realistic expectations and
Yes.
goals, right? And again,
Easier
it's a
said than done, but
process.
absolutely
I can
so
imagine,
true. Yeah.
But do you see where, let's say, fear can also be irrational and unfounded because it's sort of in a vacuum, right? Fear that's in a
Absolutely.
vacuum. And so how, fear can also prevent people from getting treatment that can make their lives much better. So, you had fear before, but would you say that was it worth it to go through that fear?
110%. Yeah,
Right.
absolutely.
And if you had let fear sort of rule the day, what would your life be like right now?
I might not be here. Yeah, that was not an option for me. Something had to shift. Something had to change.
I agree. Something had to change. My symptoms got so bad in the last 6 months prior to surgery that I was just not happy with my life. And now I'm almost symptom free. Other than my voice is crappy a little bit. They still haven't tuned that out yet. But I'm pretty much symptom free. I can do all the little things that I had trouble with before. Even just everything from showering to my daily routines. Now I don't even think about it. I'm back to pre-Parkinson, if you would.
It's nice to be able to button your own pants.
And
It really is.
what are you training for?
I'm training for a half marathon.
What? Oh, not me, but good for you. That's incredible.
Do you feel like you made the decision at the right time for both of you? Or do you feel like, could you have done the surgery earlier? Do you understand what I'm
I
getting
do.
at?
My symptoms got so bad to the point where I think it was perfect timing for me.
Well, but knowing what you know about the results that you're getting right now, would that have impacted your decision to maybe have surgery earlier?
Sure. I don't think I was really a candidate any earlier than I was.
But let's just sort of,
In a
hypothetical sense, because again,
would I have participated earlier?
right, in other words,
I
what
wish
you
I
know, right. That's
Sure, yeah. Probably because I was diagnosed 4 years ago this month, but had symptoms for 6 years before that, so about 10 years ago total. So I'd say probably a good 2 years ago would have been great.
Mhm.
Sure.
How about you?
Probably about a year ago for me.
Right.
So the symptoms really started ramping up on me.
I think that that's not uncommon. I think probably most patients probably are making the decision or going through the decision of surgery a few years later than probably they ought to, for a variety of these reasons that we've been talking about.
Yeah.
And so I think, the more information that gets out there, really good information, will help patients sort of cut that process down.
Sure. That makes sense. I think just knowing that it's available and then asking, I think that, I don't remember, I know can I say who our neurologist is? I'll just say my neurologist.
Yeah, that's
So-
right. Yeah,
so my
better.
neurologist.
Yes.
Had mentioned this to me at whatever point, but I don't remember it being, I just remember, I'll say this, it's important to be proactive, to advocate for yourself, I think. And I have a great neurologist, so that's not the issue at all. But I
Right.
think it's important to advocate for yourself.
Yep.
That's what I'd say.
And have advocates, be your own advocate, but have great advocates around you. I think it's very
Absolutely.
important, whether it is family, friends, or, your healthcare team, which is really crucial. Do you recall being awake during the surgery?
I do. I didn't really bother me. Awake and back to sleep
Yeah.
multiple times.
Right. I hear different things. Some people are more aware, and some are less. It really varies again.
Sure.
And in regards to the programming process, have any of you been self-adjusting your own deep brain stimulation?
Tuned it down a couple of times when I felt tingling. But other than that, I don't on a normal daily basis feel the need to try to adjust.
Yeah, I have not adjusted myself.
I think we've kept up with your programming. Usually it's once every couple of weeks, once a month or so. I think we pushed out every 6 weeks or 8 weeks. So it's in the beginning, it's more, and then it kind of comes to fruition.
I think that's kind of what I was getting at with the other. One of the nice things about DBS is it helps you forget you have this disorder, right? I mean, that's the goal of a really good therapy, is it makes you forget, right? I mean, you either forget a medication dose or you forget the impact that this has on your life, where before every waking moment is impacted. And so, the drug pump that's available, I was trying to point out, if you have a tube that's coming out of your stomach, it might take care of like the fluctuations of this, but boy, that's a pretty big reminder that you have this disorder. And I would think that one of the really main goals of DBS is to help you forget.
I don't think about having Parkinson's anymore.
Yeah.
I don't carry this around normally. I don't think on a day-to-day basis. If someone didn't remind me, I wouldn't even realize I had it anymore.
Right.
I think, again, just a reminder that this is such a dynamic process, which is very good, because over time, you both come in with some symptoms that might have broken through, and what do? We adjust, right? There's, I think, we told you, more than 40,000 different configurations. Some people do choose to self-adjust, and some, will just come in. So, again, everyone is very different, but not only did you mention the versatility, but it's just a dynamic kind of thing that we continue to do.
We're a work in progress.
Yeah, that's great. It's been a pleasure to have you as a work in progress. And I think, like you mentioned, some fine tuning, like what we're trying to do for voice or, some of the other complaints is very doable.
Hi from Kansas. Hello.
Hi, Kansas. That's great.
Do we have any other questions out there? Let's see here. Let me rotate this down. Here we go. Nope. Oh, that's it.
So there is a question that came in earlier. This is from Marcy. Can DBS help for epilepsy?
So yeah, recently Medtronic, one of the manufacturers of deep brain stimulation, received approval for deep brain stimulation for various forms of epilepsy. It's obviously not all forms of epilepsy are appropriate for this, but yes, this is a tool that can be used for medically treatment-resistant epilepsy.
This is from Mohammed. Can you talk, either one, dear Michael, about what benefits you felt after the deep brain stimulation?
When slowness and movements disappeared, my day-to-day function went back almost to completely normal. I can get dressed by myself. I don't think about it anymore. I had trouble before that, getting to the front, putting socks on, leaning against the wall to try to do my day-to-day functions. And it's all back to normal now, pre-Parkinson's.
And for me, again, it was the dyskinesia disappeared completely. And also, I was having a lot of slowness in movements, which I still have slowness, especially when my medication starts to go off. But I was having trouble walking, so I could walk, but I would have to think about it. So now I feel like I don't have to think about walking anymore. I can just walk.
It's much more natural.
Yes.
Very interesting. Brian, a question came in earlier. Is there any chance at all of being asleep?
Yeah, so, we've done DBS on patients asleep a number of times. Some patients, due to the anesthesia, sleep through most of it and don't have any recollection. So it really kind of depends on the patient. But the answer to that question is yes. There are pluses and minuses that go along with being asleep. And it's just something that I have a discussion with patients during, before surgery, if it's something that they really want to pursue, I explain to them the role of being awake and also what you gain from being asleep. And so it's just, again, a way that we can tailor the process for you.
And we have some live questions coming in, but I'll ask you a couple of the ones that came in. I'm glad you're here because they're mostly surgical. How long does the surgery take?
Surgery takes about 3 hours. I do the surgery in 3 stages if it's done bilaterally, and so each phase takes about 3 hours.
Yeah, and then another question, and I think this is kind of a joint, should be a joint response. What is the success rate of the surgery? Because there's many different factors that determine successful outcomes. In my opinion, from a movement disorder perspective, it's definitely making sure that we're picking the right patients so that they're the right candidates going forward. And then there's some success factors based on obviously intraoperative and postoperative.
Yeah, I mean, the long and the short of it, in an appropriately selected patient with a lead that's placed in the appropriate area of the brain, I have not seen a patient not respond to the stimulation. So, so I think that's important to sort of gauge any sort of, or frame any sort of questions about what's the success rate. It's if you go to a center that's extremely experienced, they select you for the surgery, and the surgery is done well in the sense that the electrode goes into, and that there are no complications from the surgery, which can happen in any sort of surgery, then I've just never seen a patient not respond. It just wouldn't make any sense. So the success rate is extraordinarily high in our hands.
Oh, absolutely. Yeah, that's why we're such proponents. And the last question that came in from a pre-Facebook Live was from Barb. Can DBS help with head tremors? So DBS is an excellent treatment for a variety of different types of tremors, not just essential tremor or Parkinsonian tremor. Some patients with essential tremor may also have involvement of the head or the neck. DBS,
or voice for that.
Or voice even, yeah. So DBS actually may help. In my experience, typically, though, it's all about the programming, and you may have to do them bilateral, so on both sides. But it is something we factor into our pre-tremor evaluation or preoperative evaluation.
Yes, especially with nuances of targeting the electrode itself, you can get a significant impact on head, neck, and voice tremor. It does require a very experienced programmer, in my experience, but it's something that is a reasonable goal for the surgery. Let's see here. Somebody asked, somebody asked about essential tremor and cervical dystonia with so-called no head tremors. I was told DBS wouldn't help with head tremors. Well, the tremor associated with cervical dystonia can also be the phasic symptoms of the cervical dystonia. That can get better with DBS. Essential tremor, head and neck tremors can be improved. The targets for those two entities are different, however, and so that might be a little bit more complicated in your particular case. How quickly do you feel benefits after DBS for tremor? Typically, during the first programming, you should have a pretty big impact, especially for essential tremor. Parkinsonian tremor can take a little bit longer to manifest itself. It's very common for patients with even Parkinsonian tremor for the DBS to sort of, on that first programming, have a deep impact on that. But there are patients with Parkinson's tremor that can take, a few months to get good results.
But still to this day, every case that I program is just like a new patient. I mean, I still get so excited when we see that tremor just melt away in the office. So really that is, it's very exciting still. How have your families been throughout the process? I mean, I know obviously you both have wonderful people around you. You need a good level of support, but have they been in tune with the whole thing?
Yeah, I have told all my family this. I have 4 kids and a lovely husband, and he's been very supportive, and it's been helpful to have that support. But he's done a lot of research on his own. He's come to appointments with me, so it's been very helpful to have family that support him.
There's a question there that says, what's better, a rechargeable or a non-rechargeable battery? Well, I think that in terms of the efficacy of the device, it doesn't matter whether the device is rechargeable or non-rechargeable. The question, I think, has to do with a patient convenience. Rechargeable sounds nice because the length of time between need for replacement of the neurostimulator can get lengthened by a rechargeable device. The primary cell batteries or the non-rechargeable batteries typically need to be replaced every 4 years or so. Rechargeable batteries are probably on the order of a decade and sometimes a little bit longer. I think it comes down to what we spoke about earlier. You know, if you have a rechargeable system, then at least with current generation of devices, you have to recharge your device every day or every other day for it to be reasonable. And that's just another thing you have to remind yourself. And so there are some patients that find that process perfectly fine, and then there are others that might say, you know what, I'd rather not think about it for 4 years and then just have a battery change, which is an outpatient procedure. It's done in about 20, 30 minutes, and then you go on with your life again. So it's kind of, again, it's not better, it's just a question of what's tailor-made for a particular patient.
Right, there's a couple different factors too. I've had some patients who opt for a rechargeable, but then they lose the caregiver, or they have to transition the living environment, and it's very hard for them to charge on their own. I have some younger patients who simply forget, which is because they're out and about and living life, and then the battery runs down, and so so there are definitely pros and cons, but it is a discussion that we have. Okay, this is a question. So no shakes, no tremors. My dad has very bad dyskinesia, a ton of pain, walks and falls down all the time. He's had Parkinson's for 18 years, and he's only 57 years old. Do you think he will still be eligible for the surgery? So there's a couple of different factors that make you a candidate for surgery. The duration of Parkinson's disease is not necessarily one of them. Age is also not a cutoff by any means. We have patients who are very young. We have patients that we do who are in their 80s and late 80s and so on. And depending on the degree of responsiveness to medication, does the pain improve? Is it maybe more of a dystonic type pain? Does the balance and the walking improve with levodopa? Potentially, your dad could be a candidate, particularly in light of the dyskinesia. As Wendy had mentioned, deep brain stimulation is a really optimal therapy to control dyskinesia. So, there's a lot of factors here that need to be taken into account to determine candidacy, but going to a center where we can dice out one by one each of these factors and determine who is the best candidate, I think is definitely your best bet. We have a Dr. Kopell is the best, and Dr. Kopell is the best. Lots of people on Kansas, Toronto, New York.
That's something else that has improved is my following. I've only followed once since the surgery, and I was following more and injuring myself. So this has improved drastically. My balance has improved.
Were the falls related to balance, or was it dyskinesia, or?
I was related to balance. My foot would get stuck, and I was falling up when I go like a step up a curve. I'd fall forward. I was injuring myself. So.
Wow,
I need a wall just to get dressed. I need a wall to lean on somewhere.
Yeah.
It's all gone.
Yeah, it's true.
I'll never be a gymnast though. Not gonna happen.
We can all train for the half mile with Michael. I commend you. That is really a feat. That's amazing. But even prior to Parkinson's, you were a runner, and you're an athlete. So
And I started cramping up as I was running, didn't realize what it was, and turned out it was Parkinson's all along.
yeah, so it's nice to pick back up and kind of
Get your life back, yes.
Right. It's really rewarding.
I've come after the surgery. For my family, I have my life back now.
How has it been transitioning back to work? Was that a tough transition for you?
It wasn't tough to go back to work, but I'm very, like, how do I say this? I get tired easily still, so that hasn't changed because you still have Parkinson's. You're still the same person in lots of ways. So I still get tired more easily than I used to. But I still work full time. I intend to do that for as long as possible. So, but the transition to work wasn't difficult. I had told many people at work that what my situation was and what surgery I was having. So it's a very open environment in that way. So I have
That's great,
support there as
yeah.
well.
Right, that's wonderful. You're so forthcoming, and I think both of you really sort of are really, excellent candidates to be the face of DBS in many ways. A lot of patients are referred in when they've had Parkinson's for a very long time, and there's felt that there's nothing left to do, and so why don't you consider DBS? Now we know that you can consider it at a much earlier level. The outcomes are much more optimized, particularly instead of going through the whole fourth line, fifth line, sixth line therapy and meds. So I think you guys really embody that. Parkinson's is not just an older person thing.
Yes.
Either. And I think you also embody a lot of,
I was in my late 30s when I first got symptoms. And there's people much younger than me.
Yeah, I know we see it quite often. So, the face of Parkinson's is changing tremendously. It's not that little old man who kind of shuffles anymore. And I think to be able to realize that every single patient is different. But in my mind, any patient that does have Parkinson's at some point should just ask themselves, well, what are my options out there? Could deep brain stimulation be right for me? And then ask your provider. I think as Wendy mentioned, unless you're your own advocate, unfortunately, we do see cases that are just not candidates anymore. And again, it was really because maybe they are asking about it too late. So,
And you want to avoid intervening too late. The idea is that if you 2 years of not having as good a quality of life as you're having now, it's hard to get that back, right? Unless you have a time machine. So advocacy for yourself or your loved ones is, I think, a really important part of the process. And hopefully this is a part of this advocacy. So, look, thank you both for coming here today. I really appreciate it. I think the patients out there really appreciate your frank and sort of unvarnished sort of like experience. I think it's important to get that through facts is the way you get through fear, right? So thank you very much. We'll have another session in the next few weeks, and keep sending your questions in, and we'll hopefully answer them the best we can and get you the best information. All right, so thanks for joining us today.
thank you.
Thank you.
Thank you.